After more than 2 years, Türkiye is easing some of its last COVID-19 restrictions. Although the most severe measures such as lockdowns, curfews and remote learning ended last year, mask mandates had still been in place. But now Türkiye is saying bye to masks indoors as it tries to bring life back to normal. Masks will still be required on public transport and in hospitals, but those requirements are slated to be ended very soon. Turkey's students will see the most relief being able to attend class without masks. Schools reopened last year, but face coverings were mandatory for all students, regardless of age. Infections across Turkey have fallen dramatically since their peak in February, where more than 100,000 cases were being recorded daily. Now, less than 2,500 are being reported a day. That sharp drop has also been seen in other parts of the world, with dozens of countries opening up to foreign visitors again. But the World Health Organization says that the virus didn't go away just because we stopped looking for it, and it's warning that new variants could still pose a potential risk. And to discuss where we are in this pandemic more than 2 years on, I'm joined by Dr. Irshad Sheikh. He is the head of the WHO's Regional Center on Emergency Preparedness in Istanbul. And from Cardiff in the UK, Dr. Andrew Freedman, who is a reader in infectious diseases at Cardiff University. A warm welcome to you both, and thanks for joining me on the program. It's been 2 years since Türkiye announced its first case of COVID-19. It was a very uncertain time because the world didn't know where the pandemic would lead to or how would it last. So, Andrew, what has changed in the world in those years, and where do we stand now?
Well, we're obviously in a lot better position than we were at the start of the pandemic, and I think that's largely due to the very successful rollout of vaccines, the rapid development of effective vaccines that, although they don't prevent infection completely, they are very effective at preventing severe disease and death. So that has made a huge difference compared to where we were right at the start of this. And of course, we also have a much better understanding of COVID-19 infection, issues like asymptomatic transmission, the fact that the virus can be transmitted by airborne spread, not just by droplets. We have more effective therapies, including, of course, steroid treatment. So we are in a much better place, but nevertheless, the pandemic is certainly not over yet. And there's always the concern about new variants coming along that may cause more problems in the future.
So before expanding on the effects on the pandemic and what we have learned so far, I just want to go over some figures that puts into perspective Turkey's overall COVID experience. Currently, infections across Turkey have fallen rapidly, standing at less than 2,500 cases a day. The daily death toll from COVID-19 has dropped to under 15. Since the pandemic began, Turkey has seen around 15 million infections and just over 98,000 coronavirus-related deaths. And as of April 27, Turkey had a case fatality rate of just 0.7%, ranking 137th globally. And when it comes to vaccines, Turkey has administered more than 145 million doses so far, and the rate of vaccinated people with 2 doses stands at just over 85%. So, Irshad, one stat that stood out to me was Turkey's relatively low death rate compared to, say, Europe and other neighboring or regional countries. What can be attributed to this? For example, was it Turkey's relatively younger population?
Yes, partially, but also in the start, we saw the majority of deaths happening in elderly population, which are at highest risks. And they were happening in advanced countries like Northern Western Europe and USA, in nursing homes where one case led to fulminant spread like wildfire of infection within confined and all high-risk individuals. In case of Turkey, we have relatively a limited number of elderly in the nursing homes, but also which were, together with Ministry of Health and Ministry of Labor and Social Welfare and Family Welfare, very strong protocols on infection prevention and control and monitoring, and most importantly, testing capacity. Turkey never came under stress because of our strong laboratory systems, and we had the PCR test ready as early as February 2020, and we actually gave some tests after getting WHO pre-qualification
Yes.
to neighboring countries. So we were, I think, one step ahead in terms of preventing our elderly, which were the highest mortality burden, at least at the start.
So, Andrew, what do you make of the world's initial response to the pandemic? How did different regions initially approach the pandemic, and what did they get right and wrong?
So obviously there was considerable variation across the world in terms of how countries dealt with it. But there was a good deal of panic, I think, in the early stages. We didn't understand enough about the infection, but a lot of countries introduced lockdowns of various severities.
Yes.
And of course border controls as well, which in some countries like Australia and New Zealand, very strict border controls, island nations were very effective at keeping the infection out, whereas other countries, Europe, the USA, even though there were some border controls, they weren't effective, they weren't tight enough. And at best, all they did was delay the importation of infection, which spread very rapidly around the world.
But Andrew, isn't it such a contrast now? Most of the world is easing these restrictions, and then you see what's happening in China, where a few hundred cases can spark strict lockdowns in cities with millions of people. Is China's zero COVID strategy sustainable over the long run, and what's fueling this?
Yeah, I'm not sure it is, and I don't think it would work in many other countries. There are very few nations that would put up with such draconian measures, I think. But if they we don't know exactly the figures in China, how many cases, we may not have accurate data, but if they've had so few natural infections, I'm not sure what proportion of their population has been vaccinated, and they've been using vaccines that probably aren't as effective as the ones we've been using in Europe and in many other countries. And so they have much less in the way of population immunity. And so there are going to be more severe infections if it does spread. But I don't think it's sustainable in the long term. Mm-hmm. Australia and New Zealand locked down, shut their borders for 2 years pretty much. But as soon as they open them again, they've had more problems because, again, vaccination rates were not that high and they didn't have natural immunity. So yes. I'm not sure that's going to work in the long term.
So, Irshad, moving on from these examples, were Türkiye able to find middle ground between countries who did little, very little, to stem outbreaks to countries, as we've just mentioned, like China, that still reacts very harshly?
No, I think that's a fair statement. Turkey did quite well in the sense that health system never came under stress in terms of political leadership, testing, health system resiliency, healthcare workforce, also making sure that we resorted to telemedicine, improving or mitigating the discontinuity of care that otherwise would have happened. We built emergency hospitals during COVID. We improved our bed to population capacity. Our family medicine model of reaching catchment populations, knowing them, contact tracing, early diagnosis, and starting treatment as early as possible, whatever limited regimens were available to us at that time. So all these factors, multitude, and I think risk community engagement and risk communication also played some part, with highest level of political leadership coming on the media and announcing the conditions and the measures. So that sort of also improved the communicability, trustworthiness, and transparency to a certain extent.
So, Andrew, how has this pandemic pushed some countries to revamp their healthcare systems, and what kind of lessons did the global health industry learn from this pandemic moving forward?
Yeah, so I mean, I think many countries, probably most countries, were not well prepared for this, including the UK, where I'm obviously based. We didn't have much spare capacity. The health service in the UK and many other countries is under pressure at the best of times. So when a pandemic comes along, it's clearly going to cause problems and possibly overwhelm health systems. So I hope lessons will be learned. There need to be inquiries. There's one just beginning in the UK to look back back at what did go well, what didn't go well. Certainly in the UK, we were perhaps a bit too slow to ramp up testing capacity. We know about the shortages of PPE, the vaccine rollout, development of vaccines very rapidly, and the rollout of vaccines was very successful. So I think we can learn a lot, and countries will learn a lot
Yes.
for future pandemics, whether it's a coronavirus or a different virus.
So you think the world is ready to embrace another pandemic?
I'm not sure the world will ever be ready for a major pandemic, but I think it will be better prepared in future.
Okay, so Irshad, what's going on in other parts of the world, especially in poorer countries which didn't have resources to provide as many masks, disinfectants, and vaccines? How are they faring now?
I think that's a great question. I think to start with, to say we are still seeing vaccine inequities. There are millions of populations which in low-income and poor countries which have not seen a single dose as yet. And as our Director General, Dr. Tedros, and Dr. Hans from our regional director called, this is a moral travesty of our times. Having said that, and coming back with the question that you had with Professor Andrews, crisis produces its own opportunity. So this is what we have learned, is that the future preparedness, it's time for new vision, next generation preparedness, preparedness without borders, where global solidarity and partnership will take precedence. And when we say no one is safe till everyone is safe, that implies no one is prepared till everyone is prepared.
So, Andrew, I understand a pandemic is still there and we still need to be cautious. But when do you think it is going to be reduced to an endemic level?
So, I think effectively it is already happening to some extent in the UK, and I think most European countries. Most restrictions have been relaxed, despite continuing high levels of infection. But those levels of infection are not translating into high numbers of seriously ill patients, and many fewer patients are now dying of COVID compared to the earlier days. So we are getting there. We still don't know what's going to happen perhaps later in the year. Next autumn, winter, we may see a surge in cases again, and we may get new variants that cause more problems, perhaps variants that will overcome the current vaccines that have been used. So we're maybe not quite there yet, but we're certainly heading in the right direction in most countries.
All right, gentlemen, unfortunately, we'll have to leave it here. Thank you very much for joining me on Straight Talk.